This is for nasotracheal suctioning. So with this patient, we have an order for nasotracheal suctioning. They have their nasal airway in place. We would check the patient's chart for the order, and then we would head to the patient's room with our supplies. You would have your sterile suctioning kit with you, and all the other supplies would be available in the room. So we'd head to the patient's room, disinfect your hands as you're entering. Hello, Mr. Blank. My name is Trisha with Respiratory Care, and today we're going to do some suctioning with that airway that you have in place. Sounds like you're having some difficulty getting those secretions up and out, so we're going to help you with that. So we are going to assess lung sounds, get their vital signs. With the oxygen level, we're going to make sure we have the pulse oximeter on the finger throughout the entire procedure, because we want to monitor that and make sure that that does not drop too low while we're doing this. So Mr. Blank, first what we're going to do, we're going to give you some oxygen, and then I'm going to use a little catheter to go in through your nose and get some of those secretions out. So before we begin, I want to go ahead and put the oxygen on the patient. So you're going to hyperoxygenate the patient. So while we're getting our supplies ready, we've got that oxygen going for the patient. We have our suctioning attached to the wall, and we're going to have our suction set at negative 100 to 120 millimeters of mercury for this patient. This patient is an adult, so that's the setting we would have. Then we're going to go ahead and open up our kit. So we have our gloves here. Opening our kit first here, we're going to go ahead and put our lubrication on the kit here, and then we're also going to have our sterile saline that we're going to have available as well within that. Put on our sterile gloves. And then we're going to go ahead and attach our suction kit. So we're going to attach our suction to the wall here, and then we're going to make sure that our suction is working. So we're going to use that sterile saline. We're going to go ahead and dip some of that in there, occlude the port, and let that sterile saline suck up into the catheter to make sure that that is working. So that is working. Then with your lubrication, you're just going to lubricate the end of that tip very well. And we're going to try and keep this hand as sterile as we can. So I'm going to release the oxygen. Mr. Blank, we're going to go ahead and take that oxygen off here. And then I'm going to go ahead and put this catheter in through the nose. So I don't want suction applied as we're going in. So we're going to enter the nair, and we're going to slowly proceed till we hear it, or till we feel the first resistance while the patient cough, or the patient may cough on their own. The second resistance, we're going to pull back slightly, and then we're going to apply the suction. As we're removing the catheter, we're going to twist it. So we'll twist and remove that catheter as we're coming out. We want this to last less than 15 seconds, the entire procedure. So we are done with that. So we're monitoring how the patient's breathing, the oxygen level of the patient. We've pulled that back out, and then we're going to use the saline to clear any debris that we have in our suction kit here, or our suction catheter here. So then once again, we're going to check with Mr. Blank, make sure he's feeling okay, he's breathing okay, check those vital signs again, look at that oxygenation level. We'll go ahead and chart what we've done, and then we're gonna, before we chart what we're doing, Mr. Blank, I'm putting some more oxygen on, so we're just gonna make sure we've got that oxygen to reoxygenate him for a moment. Okay. Then we're gonna make sure, we're gonna remove the oxygen, make sure Mr. Blank is comfortable, make sure he doesn't need anything. And then that's when we would document what we're doing. So thank you, Mr. Blank.